Yesterday, the federal government made two announcements. First, the U.S. Department of Agriculture made a departure from their decades-long use of the USDA Household Food Insecurity Tool and the measurement of this data. This tool has been used since the 1990s. This is how we measure outcomes across time, connect policy changes to real-world impacts, and identify where interventions are needed. Scientists use these data sets to understand how systems-level changes impact the food system and the food insecurity of our communities. Without these data, our ability to track and respond to hunger is weakened. In the evening, the Trump administration announced that there were studies correlating Tylenol use and autism and that they had identified it as the likely cause. Correlation is not causation. Sometimes we see spurious correlations, like murder rates moving in step with ice cream sales, or Bank of America stock prices line up with the number of ninth graders in U.S. schools. They look connected when you plot those trend lines on a graph together, but they're not. With nutrition, sometimes, even in those early stages of research, when we see a potential correlation, we might make changes if there's no risk. Let's say between food dye consumption and childhood behavior. If there's no known benefit to an additive, it makes sense to give people clear labeling and the opportunity to avoid that if they choose. Avoiding something can cause more harm than good. With Tylenol, for example, the risk of untreated fever or unmanaged pain in pregnancy might be a better risk than the theoretical risk from the medication itself. That's why leading medical groups continue to recommend Tylenol as the safest option for pain and fever management during pregnancy. In Connecticut, I'm going to continue to work to ensure that our policy decisions and our work is rooted in science and it's transparent. Connecticut cannot look away, and neither will I.